everyone, and welcome to another edition of Booming Encore's Learning Bites. My name is Susan Williams, and I'm the founder of Booming Encore. Today, I'm joined by Dr. Rhonda Collins, Chief Medical Officer of Ribera, in our second segment of Managing Your Meds. Welcome, Dr. Collins.
Thank you. Glad to be here.
A pleasure to have you. Now, Dr. Collins, in our first segment, we talked about what people should know when they're prescribed a medication. And today we're actually talking about what people should know when they're taking their medications. So let me start with the first question. I know that whenever I'm prescribed a medication, the first thing I do is jump on the internet and I research it. Is this really a good thing for us to be doing?
Well, you are not alone. Everybody I know jumps on the internet to try and gather some information about medication when they're prescribed or general health information. And it's not a bad idea. Certainly there is some good information out there. I just need to caution people to be careful. You can't always believe what you read. There are a lot of reputable websites that provide excellent health information. And those are places like Johns Hopkins Health Library, the National Institutes of Health, the Cleveland Clinic, and actually can share some of those good websites with you as far as links. But some of the websites are not reputable. Anybody can put anything they want, as you know, on the internet, and it may not be good information. So some of the things I would recommend when you're looking at internet information is look for sites like I mentioned. Try to steer away from .com sites and be cautious of ads. Sites that have ads aren't necessarily the most beneficial sites. Go for the .org and .gov sites. Make sure the articles you're reading are less than 3 years old, and look at the credentials of the people authoring those articles. You want doctors and nurses and pharmacists when you're reading health information, particularly when it comes to medication.
Terrific. That's some great advice. We'll definitely share those links along with our post. Now, when someone's actually taking their medications, what are the most important things they should really be doing?
Well, the first thing is to learn about your medication. You really want to know what you're taking and why. I can't tell you the number of patients who have said to me, well, I take a little red pill. And they don't know what it's for, and they don't know the name of it, and they don't know the dose of it, and they just know when they take it. You really need to know what you're taking and what the name of it is and what the indication is. You really want to talk to your doctor about the potential side effects. So what's the most common side effect and what's the most serious side effect? So you know the things to be on the lookout for. I think I mentioned previously, you get the big long list from your pharmacist that lists all the potential side effects. And while most people won't experience those, knowing the ones that are probable and the ones that are the most serious that would cause you to seek medical attention are the things you need to be aware of. The dosing, the timing, also keeping an updated list. So a lot of people attend different physicians, specialists, clinics, going into hospital, and there are a lot of people that are potentially looking at your medications and changing your medications. So it's important to keep a list with the dates, the times you take them, the frequency, the dosing, when you take them, and get that list updated anytime a medication is added or taken away.
And is storage something someone should be concerned about?
Well, from a safety standpoint, yes. I've always recommended that people keep their pills in their original containers with the labels on them. I've seen a lot of people put all their pills into one little container, and that can get challenging with regard to when they're supposed to be taking them and what they are. And so I really strongly encourage original containers with labels intact, unless, of course, you're using a pill reminder.
Okay. So Dr. Collins, what should somebody do if they actually experience a side effect?
Well, it depends on the severity of the side effects. Some mild things like a headache or nausea, stomach upset are the type of side effects that often go away within the first couple of days of use. And so if it's a minor side effect like that, it's good to talk to your doctor or pharmacist to determine if this is something that's transient, it's going to go away, and you don't need to stop taking the medication, or there's something else you can do to help, like taking it at a different time, for instance, with food or without food. And if it's something serious, then obviously you need to seek medical attention. But the very best thing to do whenever experiencing a side effect is talk to your doctor or your pharmacist and determine what the next best steps are.
Okay, terrific. Now, what should somebody do if they happen to miss a dose, though?
Well, it depends on the medication. So there are some medications that have very specific guidelines about what to do if you miss a dose. So I'm thinking about things like cancer drugs or drugs that people take if they've had an organ transplant, the anti-rejection drugs. There are some very specific things regarding dosing and timing with those if you happen to miss a dose. So in those situations, it would be best to talk to your specialist before making a decision. Most of the time, if somebody misses a dose, within 2 hours, it's safe to take that missed dose. It depends beyond 2 hours on the number of times a day you're taking a medication. So if it's a once a day medication, it might be just fine. If it's a 3 or 4 times a day medication, then a couple of hours may make a big difference. So I think the general strategy is if you miss a dose and it's within 2 hours, you're safe to resume, take that dose now. If it's been more than 2 hours and it's a multiple times a day dose, you should talk to your doctor or pharmacist. There are websites that you can look at, particularly the monographs for the medications. So we previously talked about the long list that the pharmacist gives you, and people have a tendency to throw that away when they get it. But I always recommend keeping it because there's really good information on there, including what to do if you miss a dose. If you don't have those sheets anymore, then looking on the website for that particular medication, looking at the product monograph, which tells you what to do if you miss a dose. And if that's difficult to find because there are so many generic drugs, and so if you're taking a generic, you may have difficulty finding those monographs, then you want to talk to your doctor or pharmacist. And the good news is most physicians are available during the day, most pharmacists are available during the day, but there's always after hours clinics and pharmacies that stay open later in the evening. So if it's a dose that you miss in the evening, then you can still talk to somebody.
Good, some good suggestions there. Now, what do you have any tips or suggestions on how people can make sure that they stay on their dose schedule?
Well, there's great products that are available. So blister packs are available from the pharmacy. And if you're taking more than 1 or 2 medications, that may be advisable, because if you have multiple doses throughout the day, it's very easy to forget your doses. I can tell you that about 80% of people miss doses of medications because of remembering to take them, or, for example, being out at a time that they would normally take their medication. So blister packs or pill reminders can be helpful, but even in the absence of those, even if you're only taking 1 or 2 medications, the likelihood is you're still going to miss a dose because, well, life is life. But I would recommend people choose a time, something that they do on a regular basis that can serve as a reminder. So a lot of people take their medication as soon as they get up in the morning with their coffee. A lot of people take their medication before they go to bed at night. And that's based on your regularity of waking up or going to bed. If you're a shift worker or you like to stay out and party until 2 or 3 o'clock in the morning, then taking a bedtime dose may not be the best thing for you. And if you're somebody who likes to sleep in on the weekends and you might sleep in 2 or 3 hours later than you would normally wake up during the week, then first thing in the morning may not be the best time. So just trying to choose a really consistent time and have some sort of reminder is a helpful thing to do.
Now, I know in our next segment, we're going to get into more details about actually discontinuing your medications, but what happens if someone just decides to stop taking their medications? Is there some risk associated with this?
There is, yeah. I mean, there are a lot of different types of medications, as you know, and some of them require some finesse when it comes to discontinuing. So not just abruptly stopping, but tapering down. And so if you don't taper certain drugs down, there's a risk of recurrence of symptoms, and there's also a risk of withdrawal effects, which can be really unpleasant for people. So yeah, next segment we'll definitely talk about what to do if you don't think you need your medication anymore, but always you want to talk to your doctor before stopping a medication.
Great. Well, thank you so much, Dr. Collins, for this valuable information. It's extremely helpful, I'm sure, to anybody who is possibly taking some medications. Now, for our next segment, as I mentioned, we'll be talking about discontinuing your medications, and Dr. Collins will provide us some guidance and advice on that. So I hope you found this information valuable, and please join us for our next segment, and have a wonderful day. Thank you.